Hello, everyone, and welcome. I'm Dr. Johnson with Alterman and Johnson Family Chiropractors, and this is Q&A with Doctors A and J. And right now I have the pleasure of sitting with Jenn Stone, and Jenn is with Jacksonville Community Midwives. Jenn, welcome, and thanks for being here with us.
Thanks for having me.
Yeah, so let's just start by, I'm curious to know how this group came to be and what, just kind of the passion that drove you to create Jacksonville Community Midwives.
Sure. So originally, we've all kind of worked together here and there. Christy and I actually started working together when I was just a nurse and a birth assistant at Fruitful Vine. We worked with Sharon there, and when Christy was a student, and that's how we got to know each other really well. And then I left Fruitful Vine and I went to midwifery school. And after I graduated, I moved back here to Jacksonville to start my own practice, the Sunshine State Midwifery. And at one point, my business partner that I was working with, she got pregnant. She moved back to Seattle to be closer to her family. And Jacinda had just had a baby. And then shortly after that, the nest closed. So Christy had called me, and we had spoke with Jacinda a little bit because Jacinda only wanted to work part-time, but also needed the backup because she just had a baby. And instead of having individual practices and all of us backing each other up, we just figured we'd all back up each other for real and just all work together. But it's been great. We really enjoy each other's company. We all work really hard. We communicate well. So it's a good fit. We all work well together.
And you, Jacksonville Community Midwives officially came to be when?
In September of last year.
Okay. And so we are going to be talking to Christy and Jacinda later this week. And so we'll be getting to know them and exploring some other aspects of the practice. But what you and I wanted to talk about was for those women who have planned a hospital birth, in the current environment, I know some of them are wondering whether they now want to choose a home birth. And just for clarification, at Jacksonville Community Midwives, it's not a birthing center. You don't do home births. Yes. So for those,
the only licensed birth center in Jacksonville is Fruitful Vine.
Yes. Okay. Yes. So talk to us about what that process looks like, that process of exploration for moms who are planning a hospital birth and what that might look like for them to transition over to a home birth.
All right. So initially it just starts with a phone call, and we just kind of go over pregnancy history, make sure that there's nothing that's going to come up and you're expected to have like a normal labor and delivery, because we still have to keep it low risk, healthy moms that come into care.
So one of the I think driving factors, well, two of moms that are reconsidering having a hospital birth, one is just COVID positive patients are in the hospital, but the other, I think, big reason is that that most hospitals here locally are only allowing one person in the room with mom. Though some are now allowing doulas, I've understood, correct?
Yeah, and that kind of changes. They go back and forth with that policy. So I've heard that some are, and then all of a sudden they aren't, and then the next day they are. So I think they're still trying to decide exactly what they want to do. So even like up until like the day that you go into labor, like you still need to call and find out if you're allowed to bring your doula with you as well.
Yeah. And
how many people they're letting in, even if it's just family.
Right. And I think that doula support is one of the biggest things that I'm hearing, that moms really want to have their doulas in the room with them.
Yeah.
So
for sure.
At what point would a pregnant mom not be eligible to transition from hospital birth to home birth with your practice? And really, I understand that there are probably a lot of variables in that.
Yeah. So it really has to be like on a case-by-case basis. So if you're later to care, like 37 weeks plus, we suggest that even if you're debating coming into home birth, to have your records printed at your provider and have them in hand, because sometimes like providers don't get back to us really fast about sending records. And, you know, we need to make sure that we check all the boxes and still have all the things. So if you're still like on the fence, like debating going back and forth with it, it's always best just to have them print your records. After 37 weeks, all of your labs are done. They'll all be in the records. Like everything will be ready to go. And that way you can just bring them with you as soon as you start care. Because at that point, you're on weekly visits too.
So moms would have their records printed to bring in for a first visit. And then that visit, I would imagine, is discernment on your part about whether you can accept them. Is that true?
Well, we kind of go over that, especially if you're a later gestation, like over the phone, and try to make those predeterminations. So that way we're not wasting your time either. Because if you leave an OB provider, sometimes they won't let you come back that late either. So we don't want you to leave their care unless you are like a good candidate for a home birth. Okay.
So then what does prenatal care look like in your practice? Are those office visits? Are they home visits? Is it a little bit of both?
It's a little bit of both. So typically your office visits are on the same schedule, or your prenatal visits are on the same schedule as they would be at the OB. But currently with all of like the COVID stuff, like we're kind of following ACOG guidelines to where we're doing only essential visits like in person to limit their exposure and to also to limit ours as well. And we're doing like intermittent with like telehealth visits, like just checking in, doing fetal kick counts. Everybody has their own urine strips, blood pressure cuff, all of those things. And just, you know, video chatting like you and I are now and going over all the things and make sure everything's going well. And then if you need labs, we're doing office visits for the lab draws, because then we can control that environment better. So like we're staggering when patients come in so they're not passing each other. There's not people in the waiting room. They're just coming in, being seen, and leave. And then we're wiping down the whole office with, you know, the germicidal wipes and all of that fun stuff.
Yes, we know all about it. It seems like every couple of days there's something new that we have to do, wouldn't you say?
Right, yeah.
So a couple more questions that just came up as I was listening to you talk. One, postpartum care with a home birth midwife, is that similar to what they would experience at their OB's office?
So we see you, we do a 24-hour phone call, just check in, make sure that breastfeeding's going well, everything seems normal. And then at 48 hours, we do an actual home visit. And at that point, we do the baby's metabolic screen. For the PKU, we check on you, like feel your fundus, check on your bleeding, do all of those things, go over breastfeeding stuff. And then if you've had stitches, we'll do a 2-week. And then just to check that, make sure that that's healing normally. And then we also do a 6-week, at which point, like if you needed a PAP, we do your PAP then and discuss birth control and all that fun stuff.
So pretty similar then.
Yeah, yes. Yeah. Aside from doing the 48-hour and the 24-hour visits, and OBs don't usually do the 2-week visit either.
Okay. So, Jen, can you think of anything else that moms or parents are wondering at this time about hospital versus home that I haven't thought to ask?
There are some debate too about some of the U.S. hospitals like separating mom and babies too. It's not just an issue not having their doula there, it's also being separated. But the World Health Organization is recommending against separating mom and babies, because that is like crucial just to their transition to the world in general. Just that skin to skin, that magical hour, like immediately after birth, like that's really essential. And we don't want to take that away from babies. And also, like, you know, the impact that it could have on breastfeeding and all of that too. So what we're finding, and we're trying to figure out how to implement, like in our practice with births, is just immediately after birth, before mom puts baby skin to skin, that she's doing regular hand hygiene and then also wearing a mask, because that's what's going to protect the baby, the transmission from mom to baby. Because currently there's no evidence of any transition like in utero, and they've like swabbed like vaginal fluid and amniotic fluid, and it's a respiratory virus, so there's no evidence of the virus like showing up like below the waist, I guess, kind of. So there's been no vertical transmission from mom to baby while they're in the womb. It's like immediately at birth, which is what sparked all the stuff with the separating moms and babies.
Right. So I honestly, I just heard this today from one mom that she's a healthcare worker. She's a nurse, and that came up that healthcare workers, I don't know whether it's automatic, but that they are already being prepared for the fact that they might be separated from their baby. So that's another good point that I hadn't thought of until you just said that. I mean,
yeah, that's kind of a newer thing that they just started doing, because at first it was showing that kids were really resilient and weren't really contracting the virus, or at least not showing symptoms. But now they're having babies with respiratory distress, and then like after the fact they're swabbing mom and she's coming back positive, and she was just asymptomatic at the time.
All right, so lots of good information. Thank you, Jen. I appreciate it. Like I said, we're going to be talking to Christy and Jacinda later in the week and getting even more information about your practice. But before we close, tell me something that you love about home birth midwifery.
I really just love the intimacy of it, and like being there, watching moms like blossom into their own, and just knowing that trust is there, and building that relationship with another human being, even, not just as a woman, but to me, that's really important for that transition to happen. Like, it's a huge part of that transition to motherhood. And like, birth is such an intimate thing. Like, you have to be able to let go, and you have to trust everybody that's in the room to be able to do that. And it is a good feeling to know that I'm that person for them.
That's very well said. I've had 2 home births myself, and it really is the most wonderful and special thing to have just that intimate circle around you in your own surroundings, and feel so loved and supported.
Yeah, definitely.
So, Jen, Jacksonville Community Midwives.
Yeah.
And we're going to put links with this for how people can find you directly.
Okay, perfect.
I imagine you're already being bombarded with questions about what could this look like.
Yeah, definitely.
All right, so you might have some more as a result of this video. And
okay, there's 3. We've got plenty of room for everybody.
All right, well, thanks for taking time to talk to us, Jen. I appreciate it.
No problem. Thanks.
You're welcome.